Welcome to tutorial 19. In this tutorial, we will review the stomatology form. We will go through a couple of stomatology exam examples, and finally we will generate a stomatology report. Stomatology is the branch of medicine and dentistry relating to the mouth and the mouth disease. It used to be practiced by physicians, but these concerns are now largely handled by dentists, who are in a good position to diagnose these problems during a patient visit. During a patient's first visit to a dental office, a dentist will examine the soft tissues of the head and neck, as well as the inside of the mouth. In other words, the dentist will perform an intraoral and extraoral exam. The software enables the dentist to record his findings and follow up on any problems. The stomatology form is a user customizable form with functionality described in tutorial number 10. In addition, the stomatology form contains graphical tools which enable the dentist to graphically record any problems and follow the problem until it is resolved. Click on button Stomatology. There are 4 predefined work descriptions. The user can add as many work descriptions as needed and can select any of these work descriptions to be included in the medical history of the patient. The difference between the stomatology form and the other user customizable forms is the functionality that is revealed when we click on button Intra and Extra Oral Exam, found at the bottom left of the stomatology form. Click on this button. The Intra and Extra Oral Exam form is divided into several areas. On the left, we have a graphical representation of the inside of the mouth, where the dentist can record graphically any problems and enter notes for the problem. On the right, we have a log of the exams that the dentist has performed. Below the exam log, we have a menu with several options from which the user can choose. We will demonstrate this in a short while. On the bottom, we have 4 text boxes where the dentist can enter information. The 3 boxes to the right relate to the extra oral exam. If the user wants to recall a patient for a stomatology-related reason, this can be handled by entering a date in the recall date. The dentist can also enter a user-defined description, as indicated by the yellow border of the description text box. To enter information in the intra and extra oral exam form, enter first the exam date. We click on the exam date text box and let's enter a date a couple of weeks ago. We can optionally enter an exam description. In this case, enter initial exam. The description field can be user-definable by double-clicking on the yellow border. To record a potential problem with the soft palate and lower gingiva, select the yellow square on the right by clicking on it And then click on the soft palate text box and the lower gingiva text box. Both text boxes become yellow. To enter a note for the soft palate or lower gingiva, click on the read-write icon and then click on the text box of interest, let's say soft palate. In here we enter the comments. If we want to recall this patient for the specific problems, then we enter a recall date, and in the description we can put follow-up exam, and we exit. On the specific day, the patient arrives for his follow-up exam. We go to stomatology and we enter the exam date, and in the description we can put follow-up exam. If the exam is performed in the presence of a stomatology specialist, then let's say the stomatology specialist identifies a problem with the two areas. So the initial problem, which was merely a question mark, has now been upgraded to a problem. Just click on the red square and click on soft palate and lower gingiva. If we want to select the exam we did on the 15th, just click here. As you can see, the color has changed. If we click on the 29th, the color has changed to a full-fledged problem. From now on, it's up to the dentist in association with the stomatology specialist to follow the problem and resolve it. To generate a stomatology report, we enter the intra and extra oral exam, and if we double click on the initial exam, we can say here that a potential problem has been identified. Need to call in a stomatology specialist. We'll set a follow-up exam in about 2 weeks from today. If we now click on the Complete Stomatology Report button, we'll see the Complete Stomatology Report, which is in reverse chronological order. And we can add as much information as we want, and in this way we have a log of the stomatology procedure.